the topic I'll be talking about presenting on is adherence to biosafety strategies among laboratory personnel caring for HIV/AIDS patients. And looking at a little background on the topic I'm presenting on, I would like to say that statistics have shown over time that over 5 million healthcare workers are employed around the world. And also by the nature of the work or the services they provide, they are perceived or they are viewed as immune to illnesses and injuries. And also, they also, in a bid to save lives, also perceive their own immunity to infectious agents, and therefore they don't adhere. They neglect the need to adhere to biosafety strategies, which is what informed this research work. And by a way of summary, I'll be looking at the need of handling HIV patients. The need of arises as a fallout of the fact that the level of perceived increased mortality and morbidity of healthcare workers due to non-compliance to universal safety precautions is higher in countries like Nigeria, which with high incidence rates more than the developing countries, the developed nations. And also, there's also a perceived high susceptibility that is attributed to level knowledge gap, and also the adherence to safety precautions or compliance to such. And also given the impact of occupational hazard exposure and increased mortality, healthcare workers have been exposed to certain hazards, which could also be attributed to the fact that there's an increased prevalence or incidence cases of HIV among the patient population, which puts them at greater risk. What are we looking at? Considering the facts above, the study is centered around identifying available strategies at the health facilities, which was carried out in 3 local governments in Akwa Ibom State. And Akwa Ibom State is a state that is located in the south region of Nigeria. And also, it has over time recorded the first incidence of HIV that was recorded in 1989 in Akwa Ibom State. And since then, it has been increasing rapidly, which has also informed this, the need to carry out this research. And presently, from the Sentinel survey that was carried out of seroconversion in 2010, it was also indicated or revealed that the Akwa Ibom stands at an equivalence rate of 10.9%, which is also why this research has been carried out. And in the midst of all this, the methods that were put into to carry out this study was an observational method, also in combination with oral interviews, which was mirroring the historical adherence pattern over the period of a year in these health facilities located in Akwa Ibom State. And also among the areas of assessment were waste segregation, safe disposal of waste, that segregation of waste now into infectious waste, based on their level of the infectious level. Those are the areas that were assessed. Safety, fire safety, and also post-exposure prophylaxis and the use of personal protective equipment were also considered, were assessed. What were the results and the findings? Looking at the areas that were assessed, which included the waste segregation and safe disposal, it was observed that the laboratory personnel across facilities, going by the interview that was conducted using a checklist and then the analysis done, it revealed that they were knowledgeable with 100% knowledge of waste segregation and disposal. But then, looking at the observing the personnel as they carry out their activities, there was a great revelation that only about 20% of them truly adhere to this measures of safety. Hence the high tendency of infection, spread of infection. And also, looking at the provision of safety functional electrical supplies with backup or such controls among the facilities, it was also observed that 46% of the facilities assessed had a steady power supply. But then when you look at their backup generator, sometimes, that's going by the interview now, it revealed that the generators were there and then UPSs, but then there was limited control over the provision of alternative power supply, which is attributed to the fact that the facility or the management, health facility management, has not been efficiently supportive of the healthcare workers as regards that. And also looking at fire safety and first aid, availability of first aid. All the facilities, they have the fire extinguishers and they have their first aid boxes. But looking at it over time, over the period that was assessed, because it was done on a quarterly basis, over the period that was assessed, it was discovered that these fire extinguishers, some of them have expired, and for some of the first aid boxes, the contents were not even there, some are expired as well, which have not been replaced. And also, looking at personal protective equipment, compliance to the use of this equipment was not encouraging because it was gathered from the laboratory personnel that using those equipment constitute a nuisance to them and also is cumbersome to use. And they also infer that some procedures are quick, so they quickly dash into it and carry out the services. And like I said earlier on, in a bid to save life, they perceive they are immune to those infections, and then they overlook the need to put on their personal protective equipment. And here listed are the references which can be looked into. And the conclusion is, biosafety measures do not have a lifespan as long as healthcare delivery is concerned, and service delivery of healthcare workers is undoubtedly needed. Hence, the protection of the health of personnel is of great importance so that we can have adequate workforce of trained and healthy personnel to carry out the services. What are the future steps? Advocacy to facility management and health facility management to get an administrative buy-in so they can support the process as it goes on by ways of developing policies, guidelines that will promote adherence to SOPs. Because looking at the study that was carried out, those equipments are there. Those biosafety strategies have been put in place. But then there's a problem of adherence to those facilities, which is largely as a result of lack of firm policies and guidelines that will guide and direct those personnel. And also the need for training of the personnel from time to time and retraining them so they can be better equipped and also be able to work on their attitudinal change, because that is highly needed. And also the involvement of government is highly needed, because there are some of the facilities that are there that, because of the lack of funds, are not able to put in those things in place, like the servicing of the fire extinguishers, their first aid boxes and all of that, which has culminated into their lack of adherence to these facility biosafety strategies. And also, which has culminated into their non-adherence to these biosafety strategies. And also, the implementation of post-exposure prophylaxis. There's a need for it to be strengthened. In the event of exposure, the personnel, they do not know where or how to go about it because of the lack of administrative controls or administrative buy-ins, which has resulted in that. And so by and large, the conclusion, or by way of rounding up this presentation, I would like to say that healthcare workers, like I said earlier, there's a high need of great importance to ensure that the adherence is there, which is largely attributed to their attitude. and also the buy-in of the government, and also the buy-in of the management, which has contributed to their lack of adherence. And without adherence to that, they are put at risk. And also the patients and the community at large is at risk of infections. Thank you, thank you, thank you.